So before going to begin this today's session, I would like to request you all, please subscribe my channel and hit the bell so that you will get all the notifications whenever I am uploading the new sessions on this platform. The today's session is refractive error, the astigmatism. This is the refractive condition of the eye. So we'll go through. We have a learning objective for this session. So we'll see what are the learning objective. At the end of this session, you will be able to define the astigmatism. You will be able to explain the causes of astigmatism, and you will be able to describe the types of astigmatism, and you will be able to explain the various evaluation techniques of astigmatism, and finally you will be able to explain the scientific correction of astigmatism. These are the learning objective for the today's session. So before going to begin with today's session, I have a quick assessment for you people based on my previous sessions. So like introduction to refractive error, refractive condition of myopia, hypermetropia. Recently, I have uploaded on this platform. So quick question based on these topics. The first question is, how does the light rays focus on the retina? The options are here. Option A, 2 points. Option B, single point. Option C is the multi-point. The correct answer is the single focal point. The light rays when travel from infinity and they focus on the retina when the accommodation is at rest, and they create a single focal point. Okay. The second question, if the rays of light converge and focus in front of the retina, the condition is called as, the answer is myopia. What happens in the myopic condition? The rays of light focused in front of the retina when the accommodation is at rest. And the next question is, what type of lens is used to correct the myopia? The correct answer is concave lenses. Okay. Now moving towards the next question, that is if the rays of light converge behind the retina, the condition is called, behind the retina focal point creates that is in the hypermetropic condition. Okay. And what kind of lenses we use to correct the hypermetropia? The ultimate answer is convex lenses. So the last question is, concave and convex lenses are called as dash dash lenses. Those are spherical lenses. We'll move towards the today's session, that is the astigmatism, introduction to the astigmatism. Astigmatism is a refractive error in which the rays of light fails to meet in a focal point, resulting in blurred and imperfect images. In the astigmatic eye, the light converges as multiple points. Here you can see when parallel rays of light coming from the infinity, they are not focused on the retina. You have multiple focal points here. So this is the condition is astigmatism, when the accommodation will be at rest. So what is astigmatism? It is a Greek word. A means without, stigma means point, that is without a point, that is means astigmatism means without the focal point. So you have multiple focal points, not a single. So that is what we call astigmatism. So we'll see what are the causes of astigmatism. Astigmatism is due to the irregular corneal curvature or a shape, or due to the change in the lens position. We have 5 main causes of the astigmatism. We'll go through one by one. The first one is corneal or an lenticular curvature astigmatism. This is because of the abnormalities of the curvature of the cornea or an lens. And the second one is positional astigmatism. This is due to the tilting or oblique placement of an crystalline lens as seen in the subluxation of the crystalline lens. And the third one is index astigmatism. It occurs rarely due to the variable refractive index of the lens in different meridians. And the next one is retinal astigmatism. This is due to the oblique placement of the macula seen occasionally. So, and the last one is disease of the conjunctiva or cornea. that is, for example, pterygium, keratoconus, corneal scar. These can cause the astigmatism. Moving towards the symptoms of astigmatism, what patient will feel with this condition? First is the main symptoms, that is the defective vision, either farsightedness or short-sightedness. Blurred vision will be there or tilted of vision. In this condition, decreased clarity or sharpness in the vision the patient will feel. And the second one is headache. Okay, and the third one is squeezing of eyes will be the symptoms, and the fourth one is torticollis, means tilted head, in which the neck muscles contracts, causing the head to twist in the one side. So this is the typical sign symptoms patient will explain to you. And then eye strain, tired or painful eyes due to the stress in the reading or seeing objects. Okay, and there will be a squint maybe. Okay, so these are the symptoms of the astigmatism. Moving towards the uh, signs of the astigmatism. As a practitioner, what you will see in the patient, when patient comes to you, so have a close observation that patient may be keeping head tilted, specifically in children, because they maintain the gaze and they try to see clearly. And the second one is half closure of the eyelids, because they create a stenopic slit effect to see the objects clearer. So this is another second signs you will see. And the decentration of the lens, this is in the rare condition, and disc appears oval shape. So these are the symptoms, signs you will see in the astigmatic conditions. Moving towards the assessment, quick assessment here. So which is the right astigmatic image in these two? The correct answer is B. So in the first image, the light rays are focused behind the retina with a single focal point, and when the accommodation is at rest. Here in the second image, you can see the light rays, one in front of, two in front of the retina, one behind the retina. These are the multifocal points formed in the posterior segment. So the condition is called multiple focal points, means astigmatism. Now we'll see how the image appears in the astigmatic condition. So the appearance of image in astigmatic eye is various focal intervals is called Sturm's conide. In the astigmatic eye, the refractive power of the cornea and the lens is not in same in all meridians. Therefore, instead of the single focal point, there are two focal points separated by the focal intervals. This is called Sturm's conide. Continuing with the same, so the appearance of the image in the astigmatic, that is Sturm's conide, we have two types of the intervals. One is interval of Sturm's, the interval between the two line of foci, that is what we call interval of Sturm's. Now the second one is circle of least confusion. The best focusing occurs somewhere inside the interval of the Sturm's. This point is called as the circle of least confusion. So these are the two intervals of the Sturm's conide. Friends, moving towards the classification of astigmatism. Here we have a regular and irregular astigmatism. These are based on the axis of principal meridian. Regular means horizontal, vertical. In this we have with the rule and against the rule astigmatism, and the oblique and bioblique astigmatism. These are the regular type of astigmatism, and the irregular one is a bioblique. So based on the focus of the principal meridians, astigmatism is classified as simple in this simple myopic and simple hypermetropic, and the second one is compound, that is compound myopic and compound hypermetropic, and the third one is mixed astigmatism, symmetrical and asymmetric also considered in this mixed astigmatism. So these are the classifications of the astigmatism. Towards the regular astigmatism, in this the astigmatism is regular when the refractive power changes uniformly from one meridian to the another meridian. In this astigmatism, the principal meridians are perpendicular, means they maintain the 90 angle each part. Towards the horizontal vertical astigmatism, that is in the regular astigmatism, the vertical beams of the light focus in front anterior to the horizontal beam of the light in the eye. The principal meridians are placed at right angles to one another, and those are in the horizontal 180-degree axis with the plus minus 20-degree rotation will be there, and the vertical planes is the 90-degree with plus minus 20-degree rotation will be there. With the astigmatism, in this rule astigmatism, the eye has too much plus cylinder in the horizontal axis relatively to the vertical axis. That is, the eye is too steep along with the vertical meridian relatively to the horizontal meridian. Now moving towards this against the astigmatism, in this type astigmatism, the horizontal meridian stays close to the 180-degree. It is steeper than the vertical meridian. Against the rule is astigmatism is a common in elderly people. Friends, moving towards the with the rule astigmatism, again here the vertical meridian is more curved than the horizontal meridian. The cause is physiological due to the pressure of the eyelid on the cornea. So up to 0.5 diopter we can ignore the refractive error as it does not cause many symptoms. So here with an example of 42 diopter at 180 angle and 40 diopter at 90 angle. Either you can correct by the minus cylinder at 180 or plus cylinder at 90-degree. Moving towards the against the rule astigmatism, the horizontal meridian is more curved than the vertical meridian. This is known as the inverse astigmatism or against the rule astigmatism. It causes more symptoms and should be corrected for minimal error also. So if I give an example here, 42 diopter at 180 and 43 diopter at 90-degree. Correction either by the minus cylinder 90 or plus cylinder at 180-degree. So you can correct with the spectacle or in contact lenses. These are the options are here. So moving towards the oblique astigmatism, when the principal meridians are at right angles but are not vertical and horizontal. Principal meridians lies between the 120-degree to 150 degrees and 30-degree to 60 degrees. So this is what we call oblique astigmatism. Simple astigmatism, when one of the principal meridian is focused on the retina and the other meridian is not focused on the retina when the accommodation is at relaxed condition. So we have two types of simple myopic astigmatism and simple hypermetropic astigmatism. In simple myopic astigmatism, when one of the focal principal meridian focused on in front of the retina and the other is focused on the retina with the accommodation will be at rest. In simple hypermetropic astigmatism, when one focal of the principal meridian is focused behind the retina and the other is focused in front of the retina with the accommodation is at rest condition. So this is what we call simple myopic and simple hypermetropic astigmatism. Now moving towards the compound astigmatism, when both the principal meridians are focused either in front or behind the retina with accommodation in the relaxed condition. So here we have the two types of compound astigmatism. One is compound myopic and second one is compound hypermetropic astigmatism. When the both principal meridians are focused in front of the retina with the accommodation is in the rest or in relaxed condition, that is we called compound myopic astigmatism. And the second, when the both principal meridians are focused behind the retina, this is called compound hypermetropic astigmatism with the accommodation at relaxed condition. Towards the mixed astigmatism. In this condition, one focus is in front of the retina and the other is behind the retina, so that the refraction is hypermetropic in one direction and myopic in the other direction. So we can correct with the mixed astigmatism using spectacle lenses or contact lenses can be used to treat this condition. Now coming to the irregular astigmatism, in this condition the principal meridians are not at right angles. Every meridian in the cornea has a separate type of refraction. This type of astigmatism is called irregular astigmatism. Irregularities in the curvature of the cornea can cause irregular astigmatism. This cannot be treated with the spectacle. So with the correction of contact lenses will be the best option for this irregular astigmatism. Now bioblique astigmatism, when the principal meridians are not at right angles but crossed obliques, like one at 30° and the other at 100°. So this is what we called bioblique astigmatism. We have different tools to identify the astigmatism. So those are the astigmatic fan, which is available with your visual acuity charts. This astigmatic fan has construction of vertical lines at different angles of the meridian from 0 to 180°. When the patient with the astigmatic error looks at the fan, some lines seems to be clearer than the others, which helps to detect the axis of astigmatism. And the second one is Jackson cross cylinder. It is spherocylinder lens in which the power of the cylinder is twice of the power of the sphere and of the opposite sign. It is used to refine the axis of the cylindrical power. So, and coming to the stenopic slit, to find out the astigmatic power and its axis, we use this stenopic slit, and we use to measure the vertex distance also. And coming to the next, that is the Placido disc. This is the flat disc bearing concentric black and white rings. A convex lens is mounted in the aperture of the center of this disc. Concentric rings presented on the disc is projected onto the patient's cornea and their reflections viewed by the examiner through the small hole in the center of the disc. So, and the second last one is retinoscopy. We used to obtain the objective measurement of the refractive error of the patient's eye. The examiner uses the retinoscope to shine the light into the patient's eye and observe the reflections of the patient's retina. And the final one is keratometry, also known as the ophthalmometer, and it is a diagnostic instrument to measure the curvature of the anterior surface of the cornea, particularly to evaluate the extent and the axis of the astigmatism. These are the different tools we use to evaluate the astigmatism. Coming to the correction of astigmatism. Astigmatism is corrected by neutralizing the cylinder in the eye with the opposite cylindrical lens. A minus cylindrical lens neutralizes the plus cylinder and the plus cylinder neutralizes the minus cylinder. Purpose is to correct the astigmatism. Now we have two meridians in the astigmatic lens. One is axis meridian and the power meridian. this axis meridian has minimum power, where the power meridian has maximum power. So it makes the eye spherical for the best vision. So here we have two lens types. One is minus cylinder and the plus cylinder. These lenses have axis as well as the power meridian. Okay, so moving towards the regular astigmatism correction, we have first primary basic option, that is the spectacle. We can use concave lenses or an concave convex spherocylindrical lenses, and the second one is contact lenses. We can use here toric lens, what we call the, this is specifically for the astigmatic condition, and in this lens we use prism blast lens. That means it maintains the visual angle, so the lens rotation will not be there with your each blink, and this maintains your axis, that will give you comfort and clear vision throughout the day. So, and the third one is the surgical correction, that we can use LASIK and epi-LASIK techniques to correct the regular astigmatism. Now coming to the treatment options for the irregular astigmatism, we have hard and semi-soft contact lenses to correct the irregular astigmatism, and the second option is the keratoplasty when the cornea, central cornea is conical, or on the third option is excision of scar or replacement by the graft. So here you can see, if the central cornea is opaque, you can transplant, and using the donated tissue you can treat this irregular cornea. These are the three options available for the irregular astigmatism. Okay, coming to the mind map, what we learned in this session. So basically we covered the entire session, that includes the definition of the astigmatism and causes of the astigmatism, and the classification, that is regular irregular types, and what are the clinical types. That means the corneal, based on the corneal change, curvature, or the refractive index and retinal change and the positional change of the lens can cause the astigmatism. And then we move towards the symptoms, the defective vision, blurred vision, headache, giddiness, head tilt, and eye strain, squinting. These are the common symptoms you will be hearing from the patients. And finally we gone through the what are the tools we use to identify or detect the astigmatism condition. So those are the astigmatic fan, Jackson cross cylinder we can use, stenopic slit will be easy to find out the angle of the axis, of the astigmatic power, and the Placido disc, whether the cornea is regular or irregular, you can find out with this, and the retinoscopy is to identify the objective correction of the astigmatic correction, and finally we can use keratometry to measure the entire surface of the cornea, okay, curvature of the cornea. And what are the treatment options available for the astigmatism? Those are the spectacle is the basic, and the second one is the contact lens, and the third one is LASIK. This is entire mapping of the this today's session. Friends, I hope you enjoyed this session. Still, if you have any question related to this topic, please mention in the comment box so that I can answer your all the questions. Friends, before going to end my this today's session, I have request, please do like and comment and share this session with your friends, family members, those who are interested to learn or study in the optometric subjects. And finally, please do not forget to subscribe, and you will get the notifications whenever I'm uploading the new sessions on this platform. My sincere thanks to all of you for your patient listening. Thank you once again. See you in the next week with the next topic.